Good morning and good afternoon. I am here to talk about surgical intervention, specifically neuromodulation in children with medically intractable epilepsy associated with Dup15q. So we'll start by telling you how I got to know Dup15q, talk about Santiago and Teddy, and hope for the future in response to neuromodulation. So Santiago really is the real reason why I got introduced to Dup15q, starting from medical school in a way that each patient, each child that I met have taught me so much, but Santiago was one of them. When I first met him, he was in the intensive care unit and having basically seizures every few minutes. This was his EEG. We captured 8 tonic seizures in 73 minutes, and this continued having 29 subclinical or subtle clinic tonic seizures. They were pretty subtle, but they're very frequent. And we both remember, the family and I remember how we first met. So this was my introduction to Dup15q. And when we were able to control his seizures, Mom had contacted Dup15q, say, well, we really need to spread this good news, and we should get to know how we could make a difference in treatment. And then Teddy came to see me in a very circuitous way. I got a phone call from California, where the Teddy got his very first, he was the youngest child to get responsive nerve stimulation. And they were traveling to California from Omaha, Nebraska, every month to get checked in. And they said, this is not sustainable. Please help Teddy. Since you arrived in Omaha, I would like you to help him. And I like to just go over what actually the mother of Teddy, who happens to be NICU nurse practitioner, she wrote and published in Business Insider what her experience has been. So this was how her article started. My son had seizures every day, and we worried about his future. A brain implant changed his life. So this is the story of Teddy, which she has so beautifully described, and I think it may resonate with many of you. My 6-year-old son, Teddy, recently said his own name for the first time. When you're pregnant and choosing a name, you imagine all the ways your child will use it, how they will introduce themselves to friends and make social connections. For a long time after Teddy was born, I didn't know if he would ever use his name, so hearing him speak it was life-altering. And around his first birthday, his doctor referred us to a neurologist. And this was the referral because of the developmental delay. And while we were waiting for the appointment, he had his first seizure, an absolutely terrifying event that landed us in the emergency room. Teddy was subsequently diagnosed with Lennox-Gastaut syndrome, a severe form of epilepsy. He was put on medication, but his seizures just became more intense and frequent. Medication did little to help. From the time he was about 1.5 years until he was 3, he was having more seizures than we could count every day. He had multiple daily convulsions, especially at nighttime, which kept the entire family awake for many, many days for 2.5 years. Every time he fell asleep or woke up, he'd have a cluster of seizures. His head would droop, his body would fall forward. In most cases, this would have been a reason for a trip to the ER. But if he went to the hospital every time Teddy had a seizure, we would have been living there. When Teddy was 3, I listened to a podcast where a doctor talked about surgical management for epilepsy. Despite that, Teddy didn't respond to medication. We had never been offered surgical options, which are seen as a last resort. Yet the treatment we were considering, a brain implant called responsive neurostimulation, RNS, was only approved for adults. And that's the true till today, RNS is only approved for adults older than 18 years of age. I knew if we didn't do something, I worried Teddy would die. So this is how the family flew to California and became the youngest person in the country to get an RNS brain implant to help stop seizures. For the first time at the age of 16, now Teddy is able to walk and talk. So that was my introduction to Dup15q. And just last week, we managed to publish this paper in Pediatric Neurology. So basically, I had 3 children with Dup15q. When you have 3 children, we have a case after case after case, which becomes a case series. And this was to let the community know that that neuromodulation can be helpful. So the title says it all: dramatic response to neurostimulation in children with medically intractable epilepsy related to pseudo-isocentric chromosome 15q duplication. So this table is a summary of our 3 patients. Patient number 1 is Teddy. Patient number 2 is Everline. And patient number 3 is Santiago. And their seizure onset was different, but it was an explosive seizure onset, having multiple daily seizures. And for Teddy, it was an epileptic spasm at 2 years of age. Or 1 year, there was a first seizure, but then he developed epileptic spasm where the treatment was started. And then for Evelyn, it was 5 years and 10 months. And for Santiago was 4 years and 10 months. And Teddy got RNS, whereas the Evelyn and Santiago got VNS, and they were really pretty dramatic response where greater than 90% seizure control was achieved. And I just wanted to, there has been a lot of information about how many different anti-seizure medication some of you, your children have been on, and this is a list basically. Teddy is now on Excobrate, the cenobamate, vigabatrin, Epidiolex, the lamotrigine, and he used to be on felbamate, clobazam, valproic acid, levetiracetam, topiramate, rufinamide, and steroid. And you can see the list of the medication that each of these children are. So it's 4 to 5 medication they have been on, which were not really helpful. And for Santiago, we've been able to really change the whole drug regimen. So now he's been treated with Epidiolex, rufinamide, ketogenic diet, and perampanel. I think we just stopped the perampanel. So this is just to give you figuratively how RNS was helpful. The RNS, because it's a responsive nerve stimulation, it records the long episode. So whenever they recognize the device recognizes long episode, it will deliver the stimulation. So you could see from over 100 stimulation per day, it's gone down to less than 50 a day. So that is a greater than 90% response, and that you could see it in this picture. So to summarize and to conclude, Dup15q, you already know this, it's a rare and less severe interstitial chromosome 15 duplication versus more common and more severe isodicentric chromosome 15 duplication. Epilepsy may develop years after diagnosis of Dup15q because initial presentation usually hypertonia, developmental delay, autism, and intellectual disability. And we presented 3 patients with isodicentric Dup15q syndrome, explosive, they all presented with explosive onset epileptic encephalopathy, who then benefited from neurostimulation. As Teddy's mom specifically mentioned, there's increased risk of SUDEP, or death due to status epilepticus in children with drug-resistant epilepsy, and specifically for drug-resistant epilepsy in Dup15q. So we need to break the cycle of epileptic encephalopathy, and you could use ketogenic diet, VNS, and most of all, I think they all having gone through the pre-surgical evaluation is really helpful. That will be important for the future of responsive neurostimulation, RNS, or deep brain stimulation that's coming really to children with drug-resistant epilepsy. So RNS and DBS are really, I feel, future now. And I think we all were very excited about the gene therapy, but in order for, unless you're in a clinical trial, the gene therapy FDA approval may not happen for another 3 to 4 to 5 years. So this is Santiago now, much happier, brighter-eyed, I think, than first picture that on the left corner. And this is Teddy. And Teddy's mom, Liz, I think this will resonate with you. Raising Teddy has changed how I talk with NICU families facing serious medical diagnosis. Before, I was focused on whether kids could achieve certain activities of daily life. Now, I understand that families just love their children. Disability isn't a negative word. These kids are amazing, vibrant members of our families and society, and we are so lucky to have them. And so with that, I'd like to end, and I thank you very much for the families of Santiago Lopez and Liz Bronson, his mother, and Dup15 Alliance. Thank you very much.
My daughter already has a VNS. Would you still think about trying an RNS on her?
Absolutely. There's no contraindication for RNS. And DBS might be almost simpler to get. RNS, you have to unload every day to store the information. But so what Teddy got was a central medial thalamus RNS, so CMT RNS. But we are thinking that CMT DBS could be as effective as RNS. So VNS does not preclude RNS or DBS. They're very different.
So would they both be used together, or would you turn the VNS off?
Sorry?
Would you use both devices together, or would you turn the VNS off to use the other?
You can just leave the VNS alone because
Okay.
they are completely different. So VNS is the vagus nerve stimulation in the neck. RNS is actually into the brain, deep into the thalamus, and then that becomes the. And in order to do RNS, though, most centers will suggest a pre-surgical workup, which I think is indicated, and everybody deserves that, is how I see it. So it's good to go through a pre-surgical evaluation and then make decision between RNS versus DBS.
Thanks.
I think it's a lunchtime. Okay.